Then what is this agonist and antagonist? The drug which binds to the receptor and elicit a response which is required, which is called agonist. At the same time, some drugs bind to the receptor but do not activate them. They are called as antagonists. By doing this, this antagonist binds to the receptor and prevents the agonist attaching to the receptor. So, for response is not produced. Now, coming to the various receptors. We have alpha and beta receptor. Alpha is further subdivided into alpha 1 and alpha 2, and beta is subdivided into beta 1, beta 2 and beta 3. Coming to alpha 1, it is primarily located in vascular smooth muscles. So, when you stimulate, there is going to be smooth muscle contraction in the vascular system, and it increases your systemic vascular resistance, thereby your blood pressure goes up. The agonists of alpha 1 are norepinephrine, phenylephrine and metformin. The antagonists for alpha 1 are doxorubicin, phenethylamine and prazosin. Coming to alpha 1 receptors, here it acts through GQ couple receptor. It increases the calcium release from calcium storage structures. Here, peripheral vascular muscle contraction leading to vasoconstriction. It can cause pyloric sphincter contraction, urinary sphincter contraction, also pupillary dilatation. Coming to alpha 2 receptor, it is located in the presynaptic terminal of the postganglionic neuron, pancreas, ciliary epithelium, salivary glands and platelet. Here, it inhibits the release of neurotransmitter. It can produce hypotension, sedation and mild analgesia. The agonist includes clonidine and dexmedetomidine, and antagonist is yohimbine and tolozolone. Here, alpha 2 receptor acts through GI couple receptor. It decreases the CAMP level and or inhibitory. The norepinephrine binds to alpha 2 receptor, and through negative feedback, it releases the further release of norepinephrine. Norepinephrine binds to alpha 2, but it has to act through alpha 1. Here, it acts as a negative feedback and prevents further release of norepinephrine. Now, coming to beta 1 receptor. Here, it is located in heart, renal system, intestinal smooth muscle, presynaptic terminal. By stimulating beta 1, you increase the contractility, atomicity of the heart, AV node conduction and the rate is increased. The example includes, agonist includes epinephrine, isoprenolone and norepinephrine. Antagonist, all your beta blockers, metoprolol, esmolol, atenolol and propranolol. Coming to beta 1 action, it acts through GS coupled receptor, thereby increasing your CAMP. It increases the heart rate, stroke volume and the cardiac output, and at the renal system, it increases your renin and increases the blood pressure. Coming to beta 2, it is located in bronchial, vascular and uterine smooth muscle. So, stimulation of beta 2 produces bronchodilation, vasodilatation and more importantly, dilatation of the coronary arteries too. The agonists include salbutamol, terbutaline and albuterol. Antagonists are beta blockers, propranolol and nadolol. Beta 2 acts through GS coupled receptor, thereby increasing CAP. It produces smooth muscle relaxation. Stimulation of beta 2 produces bronchodilation, decreased peristalsis, and your glucose metabolism can be altered by gluconeogenesis and glycogenolysis, decreased urination and peripheral vasodilatation.